Welcome back to We Do the Heavy Lifting. I'm your host, Dr. Jenna Yentis, and today we're going to talk about shockwave therapy. It's probably not what you're thinking. No, we're not going to be like electrocuting anybody today. Well, it could be fun. But what we're going to talk about is how you use that in a therapy or a rehabilitation, physical rehabilitation, like physical therapy, athletic training settings. And our guest today, I'm really excited, was one of our speakers for Hilliard Discussion 13. It's Dr. Heather Linden from the UFC, and you're the Senior Director of Physical Therapy at the UFC Performance Institutes all over. We've got one here in the U.S., you've got one in China, one in Mexico. You've got them. You're a busy person. And so let's just kind of get into it. So what exactly is extracorporeal shockwave therapy?
So extracorporeal shockwave therapy is a modality that we use, especially in the orthopedic setting in this day and age with athletes. What it is it's acoustic sound waves that penetrate the skin. With that, it does so many things. It does tissue regeneration, it stimulates growth hormone, it stimulates your body's own natural stem cells, and with that, it repairs tissue at a faster rate, it reduces inflammation, and it also has an analgesic pain response where it reduces pain when it comes to injuries. So it's a great new modality. I mean, it's been around initially from the 80s and 90s, but really in the orthopedic setting, I would say it became popular about 10 years ago.
Okay, so you said it's an acoustic wave. So it's a sound wave then?
Yes.
So can you hear it?
So you actually hear, it depends on which generator you use. There's two different types. There's a radial or there's a focused. The radial sounds actually quite aggressive. It's a bullet going back and forth really fast at a very fast pace that creates that sound wave that penetrates the skin. It literally sounds like a train. So you turn it on, and because you've just told an athlete it's shockwave, and then they hear it, they look at you with cross eyes, and they're like, what is this going to feel like? So I normally will put it across tissue that's not injured, because honestly, you don't feel anything.
Okay.
Because you can actually use it diagnostically as well. So if you were going to go over top of tissue, you would feel nothing until there's inflammation or some kind of injury, and then those sound waves penetrate the tissue and you feel a lot more. So you'll start at a lower intensity and work your way up, but it can be used diagnostically and therapeutically.
Okay. So then the sound waves kind of, the waves kind of vibrate the skin then, correct? So it's sort of that vibration is breaking up whatever's in there?
Yes, exactly. So that vibration causes like a micro trauma in the tissue.
Okay.
With that micro trauma, then you have all the biological responses.
Okay.
So, and that's really where all the magic happens. But really, if you're going over tissue that's not uninjured tissue, you really don't feel much at all. That sound wave penetrates really seamlessly.
Interesting.
It's when the sound wave hits inflammation, hits a bony injury, a fracture, a ligament injury, is where it then causes that vibration to cause that micro trauma, and that's when you really feel it.
It's kind of like one of those things where even like ultrasound, if you put it over like a stress fracture, it's so painful.
You're exactly correct.
I found that out personally.
You're exactly correct. Yep.
Yeah. So it's kind of the same idea. So is it then when you put it over an injured area, you can feel it, but is it like on a pain scale? Or are we talking like a 10 or are you talking like a 6?
It can be mild discomfort. I would say over a bony injury, it's a little bit more severe. So I would probably say like a 6 or 7 out of 10. But then over like muscular or ligaments, really it's only like a 2, 3, or 4, I would say out of 10. So it's not too aggressive.
Not bad at all. So I guess you've talked a little bit about what the advantages of using this treatment. Why would you use this treatment over something else like an ultrasound or, dry needling is popular or something like that?
So it's a very quick treatment. And in the athlete population, they tend to want biggest bang for your buck, quick results. I can do this treatment somewhere between 2 and 5 minutes. And the treatment is complete. So you can also do it multiple days in a row. And they also don't have to take any time off. So they could go right from treatment out into sport and there's no issues. So that's definitely why I would pick it. It's also very quick with its results because it has the analgesic pain effect. Literally, someone will get the treatment, be like, I don't feel that pain anymore, and then can go perform at more of an optimal level so that pain doesn't inhibit what they're doing.
It's really interesting. So a lot of our listeners are not athletes, probably not at the level you're dealing with, combat fighters, professional. So what would be a typical use for it in maybe just a community physical therapy clinic?
Yeah, so that's a great question. And literally, probably last week, I was working with one of my professional golfers, and they asked me to see their father, who is in his 70s. He was complaining of back pain, referring. He has had a total hip replacement. He has had a history of disc injuries. And, we were like, is it possibly the hip replacement is wearing down because it's been over 10 years? Is it the disc that you're maybe pinching and causing some radicular symptoms? After doing a full evaluation, I realized that he had a positive orthopedic test that showed me his SI joints were really stiff and limited. And that's why I think he was pulling from not only the back, but the hip, the, above and below parts of the body. I used shockwave on both of his SI joints regions and a little bit into that glute
Before you
med.
keep going, what's an SI joint for our general listener?
Yes, so
you
that
make
is
sure they know about what body part you're talking about.
So that is your sacroiliac joint. And that's really where, if you look at your back, your spine, it comes down and then your pelvis comes in.
Yep.
So right where those connect, you'll have these little joints that it's very micro movement. I mean, it could be a controversial topic if they move or don't move, but we won't go into that.
For another podcast.
Yes. So you're supposed to get a little bit of movement. You need to disassociate your low back from your hips. That's a common reason why people actually have low back issues. And we see a lot of that in the general population. Sitting for longer periods, driving for longer periods. Our jobs are more static. So that is a common issue. The gentleman probably wouldn't tolerate aggressive manipulations and things like that because he's a little bit older. So by using this modality, I just put it on his buttocks muscles and around that joint right there. And literally he got off the table immediately, 5 minutes, and was like, I have no pain. I don't know what you just did. He didn't have the referral pain from the hips. He didn't have the referral pain from the back. And so that is, you can use it in the general population equally as much as an athlete.
Yeah.
Yep.
Well, last night during your talk, you were talking about using it for plantar fasciitis as well, which is something that, I mean,
my mom has it.
I hope I'm not your mom's age, but I hope I know the date that I woke up with it. And it's like, a lacrosse ball is my best friend.
Yeah.
But something like this, I'm like tempted to go find a physical therapist.
So that actually brings such a great topic up. So that is exactly why I searched out this modality. Because a lot of our long distance runners at the Olympic level, when I was at the Olympic Training Center, had a lot of plantar fasciitis issues because of shoes, running distances, and literally the normal management of a plantar fasciitis is obviously stretch out your calf, make sure your ankle mobility is good. The lacrosse ball, maybe an ice cup, things like that are what people are told to do, but that's a long journey. So 10 years ago, we started sending our track athletes up to Boulder because we didn't have a shockwave at the Olympic Training Center. And literally within 2 or 3 days, their symptoms were resolved. And this is things that they were dealing with a few weeks trying to do the normal, typical therapy modalities that we were taught in school. So that is why I really searched out the modality, because for us to be able to get that track athlete back in 4 days, where the common person might be like, I've had this for months.
Yep.
It's a hard diagnosis to get away with because you don't get off your feet. You do have to stand to do things. So this modality is a great adjunct to add into that and gives you a quicker, solution. It allows those tissue to actually heal, where a lot of the other things, like a reason you might get plantar fasciitis is because that plantar fascia doesn't get a lot of great blood flow. It's kind of now that tissue isn't as great as it was. So it takes a lot for that collagen to re-stimulate and repair, but this modality does that for itself. So why not add that into your treatment?
Yeah. See, now I'm gonna seek out a physical therapist in town to go get my feet just shockwaved, and
it will help significantly.
Yeah. So we've talked a lot about shockwave therapy and talking about the mechanisms at which it works and sort of that type of thing. And anything else you want to add there? Because I do want to shift to a different topic, if that's okay with you.
No, I love that. I mean, I hope that I brought a little more knowledge about the shockwave modality. And I mean, I would definitely sort it out if you are, just suffering from tendonitis, plantar fasciitis, any kind of bone injuries. It does so much. So look into it. It's a great adjunct.
All right. And to do that, you would probably, in Texas, you can go see a physical therapist without seeing a physician first. But most states, if you're listening from other places, you probably need a referral to a physical therapist, and then they can help you with that. So I work in kinesiology, and all of my undergrads want to go to physical therapy school. But not only that, there's a good portion of them that want to work with professional athletes. So could you talk a little bit about your path of how you got to where you are? So just so they can hear different paths from different people.
Yeah. So I would say, looking at most sports physical therapists, I was a little bit of a different path. When I was a new grad, I was female. This was 20 years ago. It was a little bit tough to get into sports being a woman. There was multiple times people were like, the physical therapy clinic is next to the male locker room or inside the male locker room. Like, legally, we just really can't consider a female right now when I first got out of school. So I really just took the next 5 years at an outpatient orthopedic clinic, and I took every continuing education course that you could possibly do. Probably not the smartest. I racked up 2 credit cards to the max, but I just knew that I wanted to not be the male-female issue. I wanted to be the best candidate, and for moving forward, places not be able to say no because I was the best candidate. So I became a nerd, put my head in the books. Pretty much every other weekend I was in a continuing ed course, learning as many tools as possible. I think so many times as clinicians, we might only go down one purpose of, I'm going to be a great soft tissue, I'm going to be a great therapeutic exercise. But really in the athletic population, you need to bridge that gap and be everything, because the athletes are so individualized and they might need various modalities and various kinds of treatments. So I did that for 5 years. And I was very lucky. My mom is pro, anything you want to do. She has supported me my whole life. And she said, I just wanted you to know you can be a volunteer at the Olympic Training Center. So I look it up initially, and it says you need 5 years experience. At the time, I only had 3.
Okay.
But let me tell you, my mother texted me on the date of my 5-year anniversary and was like, you got to apply. And I'm like, she's like, you might go to the London Olympics. And I'm like, Mom, slow your roll. I'm not going to the London Olympics. But mothers are always right. Yes. So I ended up applying for that position. I did get selected to be a volunteer for 2 weeks. You go to an Olympic training center, and you really get to dive into working with athletics, and you're their right-hand man, and you get to do a lot of things. Initially talking to the people I was volunteering with, they were all like, I know somebody, I know somebody, I know somebody. I was like, I just don't know that guy. Like, I need to find out who this somebody is.
I see.
So, I remember calling my mom and saying, this is really cool. I love working with athletes, and I definitely think it's a passion that I want to continue to pursue. But I don't know this somebody, Mom. But my mom is like, just be there, be present, do what you've known. You've, taken these last 5 years to learn as much as you can. And I just put my head down and worked, grinded it out. And athlete after athlete I saw kept, I guess, talking about me, talking to coaches, talking to, and literally after my first week there, the boss of the sports medicine clinic asked if I could stay after work and talk with them. And I was like,
uh-oh,
what did I do? I mean, I hate that we have to think that, but immediately I did. Yeah. And, I go in their office and they're like, please sit down. And I was definitely scared. And they said, nobody knows this, but we have a position available, and we would like you to consider it.
That's amazing.
Right. And my mouth dropped because my whole life was in California. Yeah. I was talking to my best friend about opening up and buying a facility together, but I knew this was the one opportunity that if I didn't take it, it might not ever, show up. So I applied. I ended up obviously getting the job. I worked almost 7 years at the Olympic Training Center. I did London Olympics, which my mom today still says, you did go to the London Olympics.
That's amazing.
Amazing. Go, Mom. I went to Rio Olympics. I went to Sochi Olympics. I was a medical director for Youth Winter Olympics. I've done Pan Am Games, Para-Pan Am Games. And literally my journey started there with the Olympic team. And, I am a little bit abnormal to today's physical therapist. I don't have all these extra initials and credentials behind my name of CSCS, OCS, all of that. back then we didn't have residencies, fellowships, but I will say the hard work and just putting my head down and grinding got me into this sports door. And now, I'm at the UFC for almost 6 years now. Yeah. 6.5 years. And, I can tell you that it's opened up so many avenues in professional sports for me. So I really think genuinely that hard grind, does prevail. And that person that is going to be the first one to take the trash out, replenish the towels, do everything from every job that comes across that's needed in that clinic, it ends up paying off.
Well, I'm really glad you shared that with us. And I'm really happy our students can hear that, because a lot of times, they think a path is linear, and they're just like, I'm going to go PT school. I'm going to do this. I'm going to do this. I'm going to do this. And I'm like, what's your plan B? Your plan C? Because it does. I mean, for you, that it's amazing that worked out for you with the Olympic Training Center.
100%.
A volunteer position turned into a real position, but that's probably one in
a million.
Yeah.
Yeah.
Yeah. So for them to hear that, don't think that, I'm just going to go volunteer and then I'll get offered a position.
Right.
The stars have to align. So there might be some other place that you have to go and grind
it's just about finding those doors that could possibly open.
Yeah.
Like, sports is really tough to get into. There isn't a lot of sports jobs. And, it's volunteering, meeting people, networking. Yeah. Those are all great ways to kind of, hopefully help others in a more smoother path than maybe some of us had. Yeah. But it's definitely something that I think, like you said, don't have a narrow-minded, open those doors. Yeah. One of those might end up surprising you.
Yeah. And if you're hesitant about going up and introducing yourself to people, do it.
Do it.
Like, just get out of your own head. I know a lot of people younger than I am, you haven't had to make random phone calls and just like randomly talk to people. You've been able to text them or email them. Just start practicing and just go up to people and just say hello and who you are and why you want to meet them.
Exactly.
Yeah, I think it's so much. Yeah. So with that being said, and everything else you've talked about, if you were to give advice to students that want to do something similar, you said, look for those doors, look for those. Is there anything else while they're in undergraduate, getting ready to apply for PT school? Any of those, what would you think of? If you're thinking about Heather back then, what would you have told yourself?
I would have told myself that find your passion. Your passion is honestly your purpose. And, don't chase fame, money. Like, find something that genuinely you love doing, because it will show. The hard work will show that you're passionate about that. And that itself will open doors and create for such a career satisfaction. Like, I genuinely love every day going to my job. I am probably one of the few people in this world that can say, I miss when I'm on the road and I'm not working with my team and seeing the successes and even the failures, because you're going to have that. So really, find that passion. I think this is a great time when you're young to figure out what you love and then follow those doors and see where they lead you.
Yeah, I tell students something similar. I'm like, what clinics have you been shadowing in? And then I'm always like, what are the pros? Talk to the therapist that you're shadowing. What's the good sides of it? What's the bad sides of it? Because working with athletes, like, you're working with an athlete that gets paid to fight, right? But that's very different than working in the community where somebody's coming because they have plantar fasciitis,
right?
Or they've got tendonitis, or they've had a knee replacement or something, and they're miserable.
But on that, I was talking to a lady last night who works with elderly, and she was like, can shockwave be used? And I said, the biggest thing I learned in orthopedics my first 5 years, there was a day my mean age patient was 95 years old. And I used to treat them like I treat athletes. Yes. I would put them on a BOSU. I would challenge them. And I feel that's something in this world. We treat them frail. We treat them...
Yeah, it's a little ageist.
We do. But you know what? They are just like my athletes. They want to be challenged. They want to. And I would say the same thing, like when it comes to modalities and everything like that in this world, you might be working on a 95-year-old lady with plantar fasciitis. If you let her be able to walk without pain, you've changed that person's life. And that's really why we go into being in service and being a physical therapist or a sports medicine clinician, whether it's an athlete, your grandmother, your friend, it's the wins when you see someone get out of pain and be able to enjoy life a little better.
It's amazing. It really is one of those careers that you can have such a huge impact on someone's life. I think of like, an older adult that just wants to get down on the floor to play with their grandkids.
Absolutely.
And it's like, if you give them the ability to do that, to feel comfortable getting down and getting back up, you have just made a huge social impact on their life.
You have. I mean, there's so many people from, all ages that I hope I've impacted being a physical therapist, and I hope I continue to impact.
Well, that's amazing. Heather, thank you so much. Dr. Linden, thank you so much for being here.
Thank
and,
you.
Taking time and traveling all the way to College Station to give a talk last night. So you can see the HD13 video of all her talk and all the other speakers. It's available on our YouTube, and we will put that in the show notes so that you can click that link and watch that if you'd like to. And if you ever have any comments, topics that you'd like us to go over, or people that you'd like to see as a guest, please email us at huffines@tamu.edu. And as always, stay active, stay healthy, and we'll see you next time.
Perfect.
We Do the Heavy Lifting would like to send thanks to our host, Dr. Jenna Yentes, this week's guest, Dr. Heather Linden, Tex Aggs for recording studio, Anisha Patel as executive producer, and Dell Billings for opening and closing credits.